Getting a doctor's appointment can be hard enough, but many of us then fail to turn up, costing the NHS millions. Now the Health Secretary has suggested that those who miss GP appointments could be charged.
I don't actually have a problem in principle with the idea of charging people for missed appointments. I think in practical terms it could be difficult to do, but I've taken a step, if you like, towards that this week by announcing that when people do miss an appointment, they will be told how much that's cost the NHS.
The NHS estimates more than 12 million GP appointments are missed every year. It's also thought around 4 million appointments with practice nurses are also missed, costing the taxpayer £160 million.
For many, the idea of charging patients goes against the very ethos of the NHS. The problem is funding, with 2/3 of NHS trusts forecasting a deficit this year.
We're doing your blood pressure today?
Yes,
yeah.
please.
Okay.
But this GP says charging patients would put people off getting the help they need.
But unfortunately the government are using this to float the idea of introducing charges, but their real intention is to introduce charges across the board. And this will have a negative effect on patients. It will put off the most needy patients, who tend to be the older people who are not in work, who can least afford to pay.
What do you think about this idea of charging patients who miss appointments?
Well, no, it ain't a good idea, is it? If you miss, you might be held up in the traffic, anything like that. So it's not a very good idea.
You don't want to be charged if you miss an appointment through no fault of your own.
Well, if you miss appointments, it means somebody else can't get an appointment. So I think it's a fair thing to do.
The government today insisted there are no plans to charge patients who miss appointments. But with the NHS facing a cash crisis, many feel that can't be ruled out in the future. Leila Hayes, 5 News.